My name is David Benson. I'm the president of DCB Insurance Marketing and Financial Services. My office receives a lot of questions from consumers regarding the federal health care bill and how it impacts them. Today we're going to spend a little bit of time talking about the Patient Protection Affordable Care Act, also known as PPACA, and try and clear up some of the questions that you might have. The federal health care bill is a very complex bill with hundreds of different provisions. Most people feel that since the bill has been signed into law, everything is already in place. Provisions from this bill will be implemented over the next 4 years. In fact, there's a few provisions that won't be implemented until 2016 or later. Here are the provisions of the federal health care bill that were implemented in 2010. The first one is lifetime limits. Up till now, PPO plans had a lifetime maximum benefit of either $5 million or $6 million. Going forward, all plans will have unlimited lifetime benefits. Regarding dependent coverage, all carriers will now cover dependent children on their parents' plan up to the age of 26. It used to be that children had to be full-time college students. That is no longer the case. Your dependent children don't even have to live in your home to be covered as a dependent on your policy. Regarding pre-existing conditions, any child up to the age of 19 can no longer be denied health insurance coverage because they have pre-existing conditions. Insurance companies have open enrollment periods, which are the months of January and February, plus the month of the child's birthday. If a child with pre-existing conditions enrolls during this period of time, they will get better rates than if they enroll in other months during the year. Rescissions of health insurance policies are now strictly prohibited unless you commit fraud or misrepresentation when completing the application. As long as the application is completed accurately, the insurance company can no longer rescind policies. You'll hear the term grandfathered status and non-grandfathered status. President Obama signed the federal health care bill on March 23, 2010. Any individual policy that was in place prior to March 23, 2010 receives grandfathered status. That means that those folks keep the benefits that were on their original plan. Anybody signing up for an individual plan with an effective date after March 23, 2010 will receive the new benefits from the federal health care bill as they get implemented. Regarding premium tax credits, any employer who has 25 or fewer employees where the salaries are $50,000 or less are eligible to receive premium tax credits of up to 50% of the amount paid for up to 2 years. Regarding the high-risk pool, if an individual cannot qualify for individual coverage, they will now have access to guaranteed issue coverage through the high-risk pool. This benefit became effective as of June 23, 2010. Employers are prohibited from sending people to the high-risk pool because they have pre-existing medical conditions. The result of doing that will result in a heavy fine for the employer. Regarding HSA plans, the penalty has changed. If you take money out of your HSA account for non-qualified medical expenses, the penalty has gone from 10% to 20%. Over-the-counter medical drugs will no longer be deductible on health savings accounts, FSAs, HRAs, or Archer MSA plans. Beginning January 1, 2014, all Americans will have access to guaranteed issue coverage. The insurance company will have the ability to bump up your premium due to pre-existing conditions, but they can no longer deny you coverage. The provision that requires everybody to purchase coverage in the United States is being challenged by 22 states. A lot of state government officials feel that this provision is illegal. A court case was heard in Florida, and Judge Robert Benson agreed by ruling that the whole health care bill is illegal because you cannot force people to purchase coverage. This case was appealed by the federal government. The appellate court will hear this case in January of 2011. The loser of that case will appeal to the Supreme Court. That case will be heard in the summer of 2012 with a final ruling by the end of 2012. For more information on provisions in the federal health care bill or general information on health insurance in general, please go to my website at www.dcbinsurance.com. Go to the FAQ section of the website and you'll have access to all the information that you need.